Hi, welcome back to my channel all about nurse. Today's episode we will talk about different routes of medication. So we talked about the 8 rights of medication administration in the last video. Today we'll talk about the different routes that we give the medication. Now medication is very important. Medication administration is very important because this is what helps our patients to be able to get better, to fight off their diseases and to manage their illnesses and help them to get into a state of more comfortable and manageable and closer to our regular parameters or normal parameters. So our first route is going to be our oral route. We know that's the easiest one. So today we're going to talk about those different routes of medication. The oral route, because we all do it. We all know about it. So let's get it in. So our oral medications are like our tablets, capsules, liquid medication that we drink. That order will be written as, let's say, Tylenol 500 milligrams PO every 8 hours. So when you see the symbol PO, you know it means per oral or via the mouth. So some of the advantages of oral medication is it is easy to administer. Once a patient can swallow, we can give it to the patient. Remember, oral medications come in the forms of liquid and tablet and caps. We also know it is convenient for home self-administration. So we don't have to keep our patients in the hospitals longer than they need to because we can send them home on their medication. Provides systemic effects because it is absorbed via the gastrointestinal tract. For example, you will give a patient hypertensive medication orally and you will be able to observe within 30 to 60 minutes. Sometimes some work over a longer period of time, but you will be able to observe the effect it has on their body. Their blood pressure tends to decrease once that medication is being absorbed properly and the body is responding. But we have some considerations to study. So considerations for oral medication is that some medications may become inactivated by the stomach acid. That's why not every medication we give as tablets, capsules, or liquid. Also, patient compliance is very crucial for the effectiveness of medication. As nurses, we know when we administer medication, it has to be given by time, especially antibiotics. For example, if you are taking antibiotics tablets, you have to finish it, not take it until you feel better. You have to finish the dose. It's very important that you finish that dosage because your body needs to be able to completely heal from whatever bacteria you are fighting. Some types of other medication we give orally. We give Tylenol, which is, we know, an NSAID. We give that for pain. Everybody takes that for headaches most of the time. It's an over-the-counter medication. We give Augmentin. That's a regular antibiotic tablet. When patients come in with small infections, we send them home on Augmentin tablet. And Percocet. Percocet is a narcotic. It is an analgesia. We give that for pain. So we know when we give medications via the mouth, it is oral medications and it is created for that. So remember, oral medications are one type. Let's get into the next type. So we just talked about oral medication. Next route we have is sublingual medication. So we give sublingual medication via putting the medication under the tongue. Yes, we put medication under a patient's tongue and it melts. So one example of that would be or nitroglycerin. We give nitroglycerin when a patient is having chest pain. Now, what do we know about when we have a patient with chest pain and we are giving them nitroglycerin? It means we need a rapid absorption. So that is why one of the advantages of giving medication sublingual is rapid absorption into the body. So GTN is to help counteract the chest pain. We need it quickly. Then it bypasses the GI tract. It doesn't have to go down into the throat. The body absorbs it right under the tongue because there is full of blood vessels and it is highly vascularized. So we want to be able to absorb that medication really fast. Also, we give medication via the buccal cavity. What is the buccal cavity? Your mouth. So the buccal means we're going to put it on the side of the gum and the cheek. So we're going to put it, so if that is example, for example, a patient having tonic-clonic seizures, their jaw is locked. You cannot open that person's mouth. It's not safe. So what would we do to help that patient? We'll give them midazolam via buccal. So you put it inside on the side here between the teeth and the gum. That is the buccal medication. So that's another route of administration of medication. So we have sublingual and we have buccal. Now, what considerations we have to remember about sublingual and buccal route is that not all medications are suitable for this route. Not everything that we give, we can give it this way. Also, we need to educate our patients on proper placement. You can teach your staff how to give this medication, or even a patient's relative at home. Next one we're going to talk about is intramuscular. Okay, so we covered oral medication, we covered sublingual medication, we covered buccal medication. Now let's talk about intramuscular medication. So we give medications via the intramuscular. So intramuscular medication is an injection. Oh my god, we all know we don't like. I am a nurse and I am terrified of injections. If you're my nurse at some point in my life, just remember Toya said she don't like injections, okay? Alright, so injections. How do we give injections? So there are muscular sites in our body that we give injections, where we pull the medication up in the syringe, attach the appropriate needle, not the 20 gauge people. Please don't try to stick the patient and give them so much pain. So we give them the medication via the intramuscular. So let's talk about the site. Mind my drawing. I'm not an artist. I'm a nurse. So look at my guys here. So we give intramuscular injections via the deltoid muscle. The deltoid muscle is on the both sides of your arm. So you see deltoids. Also we give it in the dorsogluteal muscle or the buttock. So we give injections there. We can also give medication via the IM vastus lateralis, which is on the thigh. The middle of the thigh. So we have the sites. We have the dorsal, which is our deltoid, which is our muscles on our shoulder. The dorsogluteal is the buttocks, and we have the vastus lateralis. Those are the sites where you give IM injection. Nowhere else, not the stomach, not the frontier. Always remember, deltoid, vastus lateralis, dorsogluteal. Remember, deltoid, vastus lateralis, dorsogluteal. IM injection. What do we give with IM injection? So we give vaccines, we give some antibiotics, we give hormones as well, and in some countries they even give things like petadine and morphine, because these things can be given via IM injection. All right, so remember, IM injection has specific sites. You don't just stick the patient anywhere. You have to remember deltoid, we go into vastus lateralis, dorsogluteal. Those are our locations for our IM injection. Then we have intravenous medication. Well, we all know intravenous medication. Everybody gets intravenous medication. So intravenous medication is when we put an IV access, a PICC line, central line, anything to access the blood stream, anything to access a vein or to have medication going into the blood. So medication is highly irritant to the skin. We can't put it on your skin, we can't put it in your mouth, put it in your vein. It goes directly into your bloodstream and circulate. So we give IV fluids, we give antibiotics, we give analgesia, we give antibacterials, we give antifungals, we give a lot of medication via intravenous, but it always is because this medication cannot be given at that time in another dosage, on the oral or sublingual or buccal. You have to give it IV, okay? So you would see like sometimes patients will be on antibiotics like vancomycin, they would be on antibiotics like cefpime, they'll be on antibiotics like cefazolin. Doctor will give it IV, especially if they want it to act fast. Remember, it goes directly into your bloodstream, so it circulates through your blood really quickly and it does it work, okay? So then remember, intravenous medication, we give it directly to the bloodstream. IM medication is an injection where we stick the patient in the muscular part, deltoid, muscle, vastus lateralis, and dorsogluteal, okay? Remember, don't forget. All right, so now we're going to talk about suppositories. What are suppositories? Suppositories are medications that we insert in different sites in the body. So it's not going to the mouth. So where will we go? So we go into the rectum, we can go through the vagina, and we can go through the male urethra. So suppositories are medications that need to treat most likely that specific area. So if it's a rectal suppository, more than likely it is going to be for pain medication. It's absorbed there because the anus is very vascular. It will absorb really quickly into the bloodstream. If it's to help with having a stool softener, it's literally right there. The bowel is full of stool. It goes into there and it helps soften the stool so the person can have a bowel movement. When we put it up in the vagina, it is to help with the vaginal flora. It is to help with yeast infections. It's to help with stuff in the cervix, in the uterus. That is why we use medication that needs to be put in at the location that it needs to work. So we use suppositories. A male urethra is the same thing. It goes in there. It's to assist in either helping the bladder, affecting that urinary system, okay? So we know suppositories are to insert, not to put via mouth, to insert. Then we have topical. We use topicals all the time. We do it at home as well. So topical medications can be creams, lotions, it can be powder. So sometimes you have have patients that have wounds and you have to do dressing and you might have to apply a topical agent. Sometimes you have to use topical agents on pressure injuries or even to prevent further breakdown of a skin. Maybe it's a stage 1 in the pressure injury. It hasn't broken skin as yet. You use topical medications for things like that. So we have triad paste. We have different cleaning agents. That is topical medication. They are not to drink it, eat it, or insert it. They are to put it on the skin. You can put it on the eyes. Topical medication also covers eye drop because it drops into the eye and is absorbed into the eye. So when we have topical medication, please pay attention when you see that order comes up in front of you on your MAR. Please pay attention. Don't just say, oh, I can just put it on the skin. You have to make sure and see where the location of application. Okay? Topical medication also could be lidocaine patches. That's a topical medication because it's an analgesia that we administer on a spot. It's a patch that we stick, or a nicotine patch. Topical medication. Remember, topical means on the skin. Skin, eyes. Okay, then we have inhalers. So inhalers, it describes itself as well. Inhalers mean the person has to breathe it in. So when we say we're giving a patient an inhaler, more than likely it's a breathing treatment. So it could be like a nebulizer for patients who have asthma. It could be an allergy medication. Somebody's having an allergic reaction and give them the epinephrine to inhale. They have that. We also have patients who have to get Narcan. Maybe the person can't swallow, or the person is not in a place with an IV access. You can spray the Narcan spray up their nose to help them wake them up, bring them back, right? That happens even at home. If someone has overdosed on an opioid, you give them the Narcan via the nose, the nasal spray, okay? Also, anesthesia, the sleeping juice. So when they put a mask on your face and you inhale that stuff, whoo, and you start counting from 10 backwards, because I like to tell you, count from 10, you're going to be knocked out. So anesthesia as well is given via the inhaler as well as IV, okay? Then we have intradermal. Intradermal is right below the skin. So we give Botox injection, then we put it in the eyebrow. Sometimes they give Botox injections for migraines. Don't think it's only for looking pretty. We do allergy testing. So allergy testing, that if you give it the allergen right under your skin, so your body could react, but don't go into full-blown allergic reaction, anaphylaxis. And also the Mantoux test. As nurses, we all do Mantoux test. So we know this one at the back of our hand. So when you go to do a Mantoux test and the nurse is administering it, you know it's right below your skin. It's not supposed to go deep. So you can see when the nurse is administering to make sure that she puts it in the right way. So intradermal is right below the skin. And last but not least, we have subcutaneous, which is a very frequent one that we use, which is into the fatty tissue, right? So you will see the order come up, especially when you have to give insulin, you have to give heparin, you have to give Lovenox, you have to give all these different medications, and you even give analgesia sometimes as morphine subcutaneously. I have given morphine subcutaneously as well. So you have different medications that can be administered subcutaneous. What is subcutaneous? Into the fatty tissue, people. Do not just tell the patient, I have an injection, and give it in the deltoid muscle, when it's supposed to go into fatty tissue. Fatty tissue locations, tummy, back of the arm. Easy. It have other places as well, but the easiest place, tummy, back of the arm. Not on the arm, back of the arm. This piece of fat right here, okay? Tummy, you're not going to come all the way up on top the stomach. Try to keep it to the low part, okay? Because think about yourself. Would you like someone sticking you to the top of your stomach? So always remember, subcutaneous is in the fatty tissue. So guys, today we talked about all the different routes of medication administration. So remember, medication administration is very serious. You have to pay attention to your routes when you're giving your patients your medication. We did it in the rights, the 8 right. Just know your different places where you give it when they have the routes, because the doctor always puts the route or the route where you have to place this medication. So you will see PO for oral, SL for sublingual, but most times it's written out now because we don't want misinterpretation. So it's written completely so you can see sublingual, you can see subcutaneous, you can see suppository. So remember, nurses, pay attention to your routes. Where are we administering this medication? So I hope today you guys learned something. I hope you refresh your knowledge. Those who are practicing nurses, our nursing students, our future nurses, I hope that you learn the routes and to understand where they go and how to place them. So look out for more videos. Look out next week. We're going to continue this. All about nursing. Let's do this. Bye.